Good morning, Father.
Good morning.
Good morning, Usha Madam.
Good morning, Father. Good morning, Shabeer sir.
Good morning to all.
Good morning, Dr. Arun sir.
Good morning.
Okay.
Good morning, doctor.
Good morning. Good morning, Father.
Yeah.
So now time is 9 a.m. We can start. Shall we start?
Yeah.
Okay.
Okay. Can we start, sir?
Yeah.
Good morning to one and all present here, our honored Lisie management and guest of honor, all treasured invitees, and of course our starling students. We are all joined together as a family to reveal our commitment to the society and to make ourselves equipped to the need of the day. I welcome you all on behalf of this entire Lisie community. World Diabetes Day is a global awareness day held on the 14th of November each year. It became an official United Nations Day in 2006. The 14th of November was chosen as its birthday of Frederick Banting, who discovered insulin. The theme for World Diabetes Day 2020 is a nurse and diabetes. The campaign aims to raise awareness around the crucial role that nurses play in supporting patients with diabetes. Let's start the ceremony. Prayer works wonders. Prayer should spring from the heart. Thinking of that supreme power who made all this possible, let's start this function by a prayer song.
സത്യമാം ശുദ്ധ സ്നേഹമാം ദിവ്യജ്ഞാനമായി വാഴും ദൈവമേ, നിത്യവും നിൻ കൃപാകടാക്ഷങ്ങൾ ഏകണേ ഞങ്ങൾക്കെപ്പോഴും. പാരിലാലും ബഹീനരായോടെ സേവിപ്പാൻ ശക്തി നൽകണം. സത്യധന്മാതി സദ്ഗുണങ്ങളാൽ ജീവിതം ധന്യമാക്കണം.
I would like to call upon our dear principal, Dr. Shabeer S Iqbal, a seasoned scholar and navigator of the flagship of knowledge, to welcome the gathering. I welcome you, sir.
Thank you, Mary Madam. So good morning to all. Most respected Assistant Director, Reverend Father Jery Njaliath, respected Dr. Arun S Menon, respected Dr. George Paulos, respected Principal College of Nursing Dr. Usha Marath, Principal Faculty Student, Lisie College of Pharmacy. Hello, namaskaram. സത്യത്തിൽ നവംബർ 14 ഈ വർഷത്തെ നവംബർ 14 ഒരുപാട് പ്രത്യേകതകളുണ്ട്. നമ്മുടെ രാജ്യത്തിന്റെ വിവിധ ഭാഗങ്ങളിൽ വിശ്വാസപരമായിട്ട് ദീപാവലി ആശംസ. അതുപോലെ നമ്മുടെ രാജ്യം കണ്ട ഏറ്റവും മഹാനായ സമര സേനാനിയുടെ ശാസ്ത്ര ചിന്തകളുടെയൊക്കെ പ്രചാരകനായിട്ടുണ്ടായിരുന്ന നമ്മളൊക്കെ ചാച്ചാജി എന്ന് വിളിക്കുന്ന കുട്ടികളുടെയും മുതിർന്നവരുടെയും ഒരുപോലെ നമ്മുടെയൊക്കെ അഭിമാനമായിരുന്ന ഇപ്പോഴും അഭിമാനമായി നിലകൊള്ളുന്ന നമ്മുടെ ബഹുമാനപ്പെട്ട ജവഹർലാൽ നെഹ്റു, അദ്ദേഹത്തിന്റെ ഓർമ്മ ജന്മദിനം കൂടിയാണ് ഇന്ന് നമ്മൾ ശിശുദിനമായിട്ട് ആചരിക്കുകയാണ്. പക്ഷെ ഇതൊക്കെ വെച്ച് നോക്കുമ്പോഴും ലോകത്ത് മൊത്തത്തിൽ നമ്മൾ ഏകദേശം 162ഓളം രാജ്യങ്ങളിൽ നമ്മൾ ആഘോഷിക്കുന്നത് വേൾഡ് ഡയബറ്റീസ് ഡേ ആയിട്ടാണ്. അപ്പോ രോഗപൗരൻ എന്ന നിലയിലും അതുപോലെ ഹെൽത്ത് ഫീൽഡിൽ, മെഡിക്കൽ ഫീൽഡിൽ, ആരോഗ്യ മേഖലയിൽ പഠിക്കുന്നതും വർക്ക് ചെയ്യുന്നതുമായ ആളുകൾ എന്ന നിലയിൽ ഈ ദിനത്തിന്റെ പ്രാധാന്യം മറ്റാരേക്കാളും നന്നായി മനസ്സിലാക്കേണ്ടതും മറ്റുള്ളവരെ മനസ്സിലാക്കിക്കേണ്ടതും നമ്മുടെയൊക്കെ ബാധ്യതയാണ്. കഴിഞ്ഞ വർഷങ്ങളിലൊക്കെ നമ്മൾ നമ്മുടെ ഹോസ്പിറ്റൽ മുഴുവൻ കേന്ദ്രീകരിച്ച് ഹോസ്പിറ്റൽ റിസപ്ഷൻ ഏരിയയിലുമൊക്കെ വലിയ പരിപാടികളായിക്കൊണ്ട് ഒരു ദിവസം ഒക്കെ മുഴുവൻ നീളുന്ന പരിപാടികളായിക്കൊണ്ട് നടത്തിയിരുന്ന ഒരു ഒരു ദിനാചരണമാണ് വേൾഡ് ഡയബറ്റീസ് ഡേ എന്ന് പറയുന്നത്. അതിന് കാരണം ഒരു പക്ഷേ ലോകത്തും എസ്പെഷ്യലി നമ്മുടെ രാജ്യത്ത് തന്നെ ഏറ്റവും കൂടുതൽ രോഗികളുടെ എണ്ണം ക്രമാതീതമായി വർദ്ധിച്ചു കൊണ്ടിരിക്കുന്ന ഒരു രോഗമാണ് അല്ലെങ്കിൽ ഒരു അവസ്ഥയാണ് നമ്മുടെ ഡയബറ്റീസ് മെലിറ്റസ് എന്ന് പറയുന്നത്. ഡോക്ടർ അരുൺ സാർ അതിനെ പറ്റി കൂടുതൽ സംസാരിക്കും. ഡോക്ടർ ജോർജ് സാർ എത്തുമെന്നാണ് നമ്മൾ പ്രതീക്ഷിക്കുന്നത്. അദ്ദേഹം രാവിലെ റൗണ്ട്സിന്റെ ചെറിയൊരു ഇൻകൺവീനിയൻസ് പറഞ്ഞിട്ടുണ്ട്. എന്നിരുന്നാലും എത്തിയില്ലെങ്കിൽ പോലും ഡോക്ടർ അരുൺ സാർ ആ ടോപ്പിക് കൂടി കൈകാര്യം ചെയ്യുമെന്ന് നമ്മളെ അറിയിച്ചിട്ടുണ്ട്. അപ്പോൾ ഇവിടെ എത്തിച്ചേർന്ന എല്ലാവരെയും ഈ പ്രോഗ്രാമിലേക്ക് സ്വാഗതം ചെയ്യുകയാണ്. ആദ്യമായിട്ട് നമ്മുടെ ഈ പരിപാടി മാത്രമല്ല, ലിസി മെഡിക്കൽ എഡ്യൂക്കേഷൻ ഇൻസ്റ്റിറ്റ്യൂഷന്റെ അതേപോലെ എസ്പെഷ്യലി ലിസി കോളേജ് ഓഫ് അലൈഡ് ഹെൽത്ത് സയൻസിന്റെയും ഏത് അക്കാദമിക് നോൺ അക്കാദമിക് ഡെവലപ്മെന്റ് പ്രോഗ്രാമുകളിലും ബാക്ക് ബോണായി ആരാണ് നിൽക്കുന്നത് എന്ന ചോദ്യത്തിന് ഏക ഉത്തരം അല്ലെങ്കിൽ ഉത്തരം എന്ന് പറയുന്നത് നമ്മുടെ ബഹുമാനീയനും പ്രിയങ്കരനുമായ റവറൻ ഫാദർ ജെറി ഞാലിയത്ത് ആണ്. അദ്ദേഹത്തെ അച്ഛനെ എത്രയും ബഹുമാനപൂർവ്വം ഈ പരിപാടിയിലേക്ക് സ്വാഗതം ചെയ്യുകയാണ്. അതുപോലെ നമ്മുടെ ഈ പരിപാടിയിൽ ഇന്ന് ചെറിയ ഇൻകൺവീനിയൻസ് ഉള്ളത് കൊണ്ട് മാത്രമാണ് ഡയറക്ടർ അച്ഛൻ പങ്കെടുക്കാൻ പറ്റില്ല എന്ന് അറിയിച്ചിട്ടുള്ളത്. അച്ഛൻ നമ്മുടെ ഏറ്റവും വലിയ അഭീതകാംക്ഷിയും നമ്മുടെ എല്ലാം നായകനുമാണ്. പോൾ കരടൻ അച്ഛനെയും അതുപോലെ മറ്റ് അസിസ്റ്റന്റ് ഡയറക്ടേഴ്സിനെയും എല്ലാവരുടെയും അവരുടെ ആ സാന്നിധ്യത്തിലും ഞാൻ ഈ പരിപാടിയിലേക്ക് സ്നേഹം നിറഞ്ഞ മനസ്സോടെ സ്വാഗതം ചെയ്യുകയാണ്. അതുപോലെ ഇന്നത്തെ ടോപ്പിക്ക് നമ്മൾ 3 ടോപ്പിക്കാണ് കൈകാര്യം ചെയ്യുന്നത്. അത് പ്രസന്റ് ചെയ്യാൻ ഇവിടെ എത്തിയിട്ടുള്ള ഡോക്ടർ ജോർജ് സാർ എത്തുമെന്ന് കരുതുന്നു. അതുപോലെ നമ്മുടെ എത്രയും ഞാൻ നേരിട്ട് പരിചയപ്പെട്ടിട്ടില്ലെങ്കിലും ഞാൻ ഡോക്ടറെ കണ്ട എൻ്റെ അധ്യാപകരും സഹപ്രവർത്തകരൊക്കെ പറഞ്ഞത് എത്രയും ആക്റ്റീവ് ആയിട്ടുള്ള അല്ലെങ്കിൽ ഈ പരിപാടി നന്നായി നടത്തണമെന്ന് ആഗ്രഹിച്ചിട്ടുള്ള അത് നമ്മുടെ പറഞ്ഞപ്പോൾ തന്നെ എല്ലാ പിന്തുണയും വാഗ്ദാനം ചെയ്തിട്ടുള്ള ഡോക്ടർ അരുൺ മേനോൻ സാറാണ്. അദ്ദേഹത്തിനെ ഞാൻ ഈ പരിപാടിയിലേക്ക് ഹാർദവമായിട്ട് സ്വാഗതം ചെയ്യുകയാണ്. പക്ഷെ ഏറ്റവും റിലവന്റ് ആയ തീമാണ് ഈ പ്രാവശ്യം തീമായിട്ട് നമ്മൾ ആചരിക്കുന്നത്. അതിന് നമ്മുടെ ലിസി മെഡിക്കൽ എഡ്യൂക്കേഷൻ ഇൻസ്റ്റിറ്റ്യൂഷന്റെ ഭാഗമായിട്ട് ആ പോയിന്റിനെ വെച്ച് ആ തീമിനെ വെച്ച് സംസാരിക്കാൻ നമുക്ക് ഇവിടെ എത്തിച്ചേർന്നിട്ടുള്ളതും ഏറ്റവും ആപ്റ്റ് ആയിട്ടുള്ളതുമായുള്ള വ്യക്തിത്വമാണ് നമ്മുടെ ഏറ്റവും പ്രിയങ്കരിയും അതുപോലെ ഏറ്റവും ബഹുമാന്യമായിട്ടുള്ള ലിസി കോളേജ് ഓഫ് നഴ്സിംഗിന്റെ പ്രിൻസിപ്പൽ ഡോക്ടർ ഉഷ മറാത്ത്. മാഡത്തെയും ഞാൻ ഈ പരിപാടിയിലേക്ക് ഹാർദവമായിട്ട് സ്വാഗതം ചെയ്യുകയാണ്. അതുപോലെ ഈ പരിപാടി ഏറ്റവും നന്നായിട്ട് നടക്കുന്നതിന് വേണ്ടി പ്രയത്നിച്ചിട്ടുള്ള എൻ്റെ പ്രിയപ്പെട്ട ഫാക്കൽറ്റീസ്, എസ്പെഷ്യലി മിസ് മില, അതുപോലെ ഇന്നിപ്പം കോമ്പയറിംഗ് ചെയ്യുന്ന മിസ് അനിറ്റ് മേരി, അതേപോലെ വിദ്യാർത്ഥികൾ എബിൻ ഉൾപ്പെടെയുള്ള വിദ്യാർത്ഥികൾ, ഇത് കഴിഞ്ഞ് പോസ്റ്റർ കോമ്പറ്റീഷൻ മത്സരം ഉൾപ്പെടെ നടക്കുന്നുണ്ട്. അങ്ങനെ മുഴുവൻ ഫാക്കൽറ്റിയും വിദ്യാർത്ഥികളെയും നോൺ ടീച്ചിങ് സ്റ്റാഫിനെയും എല്ലാവരെയും ഞാൻ സ്വാഗതം ചെയ്യുകയാണ്. അധികം ദീർഘിപ്പിക്കുന്നില്ല. സാറിന് ഉൾപ്പെടെ റൗണ്ട്സും അതേപോലെ OP പേഷ്യൻസും വെയിറ്റ് ചെയ്യുന്നുണ്ട് എന്ന് പറഞ്ഞിട്ടുണ്ട്. അതുകൊണ്ട് നമ്മൾ ഏറ്റവും പെട്ടെന്ന് തന്നെ ഇതിലേക്ക് കടക്കുകയാണ്. ഒരിക്കൽ കൂടി എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊണ്ട് ഞാൻ നിർത്തുന്നു. എല്ലാവർക്കും ദീപാവലി ആശംസകൾ, എല്ലാവർക്കും ശിശുദിനാശംസകൾ, എല്ലാവർക്കും ലോകത്തിന് നന്മക്ക് അല്ലെങ്കിൽ ഡയബറ്റീസ് മൂലം കഷ്ടപ്പെടുന്നവർക്ക് സേവനം ചെയ്യാനുള്ള മനസ്സും സന്ദർഭവും സാഹചര്യവും ശാരീരികമായ പ്രാപ്തിയും നമുക്ക് എല്ലാവർക്കും ഉണ്ടാകട്ടെ എന്ന് ഞാൻ ആശംസിക്കുന്നു. നന്ദി, നമസ്കാരം.
Thank you very much, Shabeer sir. What you are is God's gift to you, and what you make yourself is your gift to God. Today, we have truly blessed and gifted person, a truest shepherd of all the lambs, Reverend Father Jery Njaliath, Assistant Director, Lisie Hospital, Lisie Medical and Educational Institutions. We are really honored by your august presence. I humbly request you to inaugurate the function and to address the gathering.
എന്നെ കേൾക്കാലോ അല്ലേ?
യെസ് ഫാദർ.
ഏറ്റവും സ്നേഹമുള്ള ഡോക്ടർ അരുൺ എസ് മേനൻ, ഡോക്ടർ ഉഷ മാരാത്ത്, ഡോക്ടർ ഷബീർ ഇക്ബാൽ, faculty members, and all my loving students. എല്ലാവർക്കും a very good morning. ഇന്ന് നമ്മൾ ലോക പ്രമേഹ ദിനം ആഘോഷിക്കുമ്പോൾ നമുക്കറിയാം ഇന്ത്യയില് ഏതാണ്ട് ഞാൻ മനസ്സിലാക്കുന്ന കണക്കുകൾ ശരിയാണെന്നുണ്ടെങ്കിൽ അതിനെപ്പറ്റിയൊക്കെ എന്തായാലും ഡോക്ടർ അരുൺ നിങ്ങളുമായിട്ട് കൃത്യമായിട്ടുള്ള കണക്കുകൾ സംസാരിക്കും. ഞാൻ മനസ്സിലാക്കുന്ന കണക്കുകൾ ശരിയാണെന്നുണ്ടെങ്കിൽ ഏതാണ്ട് 8 കോടി ആളുകൾ പ്രമേഹ രോഗികളായിട്ട് ഇന്ത്യയിലുണ്ട്. അതില് ഏതാണ്ട് 20% ആളുകളും കേരളത്തിലാണെന്നാണ് കണക്കുകൾ ഞാൻ മനസ്സിലാക്കുന്നത് ശരിയാണെന്നുണ്ടെങ്കിലും പറയുന്നത്. അപ്പൊ കേരളമാണ് ഈ ഡയബറ്റീസിന്റെ ക്യാപിറ്റൽ, ഇന്ത്യയിലെ ക്യാപിറ്റൽ എന്നാണ് പറയുന്നത്. അത്രയേറെ പ്രമേഹ രോഗികൾ ഉള്ള ഒരു സ്ഥലമാണ്. നമുക്കൊക്കെ പരിചിതരാണ് പ്രമേഹ രോഗികൾ. മിക്കവാറും നമ്മുടെ വീട്ടിൽ ആരെങ്കിലും ഒക്കെ കാണും പലപ്പോഴും, അല്ലെങ്കിൽ നമ്മളുടെ പരിചയക്കാര്. അപ്പൊ ഈ പ്രമേഹ രോഗികള് ചില രോഗങ്ങളുടെ കാര്യങ്ങൾ പറയുന്ന പോലെ നമുക്ക് ദിവസവും തന്നെ കാണുകയും ഇതിനെപ്പറ്റി സംസാരിക്കുകയും ഒക്കെ ചെയ്യുന്ന ഒരു കാര്യമാണ്. ഈ പ്രമേഹ രോഗത്തിന് ഈ കോവിഡിന്റെ കാലത്ത് കുറെ കൂടെ ഒരു ഫോക്കസിലേക്ക് വന്നിരിക്കുന്ന ഒരു കാര്യമാണ്. ചില കണക്കുകൾ പറയുന്നത് ലോകത്തില് കോവിഡ് മൂലം മരിച്ചു എന്ന് പറയുന്ന ആളുകളിൽ ഏതാണ്ട് 90% പേർക്കും ഡയബറ്റീസ് ഉണ്ട് എന്നുള്ളതാണ്. കേരളത്തിലെയും ചില കണക്കുകൾ അതാണ് പറയുന്നത്. കൃത്യമായിട്ടുള്ള ഒഫീഷ്യൽ കണക്കുകളൊന്നും പുറത്തങ്ങനെ നമുക്കറിയില്ലെങ്കിലും ഡോക്ടേഴ്സൊക്കെ പലപ്പോഴും അവരുടെ സംഭാഷണങ്ങളിലൊക്കെ പറയുന്ന ഒരു കാര്യം, കോവിഡ് മൂലം മരിച്ചു എന്ന് നമ്മൾ പറയുന്ന ആളുകളിൽ 90% പേർക്കും ഈ ഡയബറ്റീസ് ഉണ്ട് എന്നുള്ളതാണ്. അതുകൊണ്ട് ഇന്ന് ഈ കോവിഡിന്റെ ഈ സമയത്തും വളരെ പ്രധാനപ്പെട്ട നമ്മൾ ഡിസ്കസ് ചെയ്യേണ്ടുന്ന, നമ്മളൊരു അവബോധം ജനിപ്പിക്കേണ്ടുന്ന ഒരു വിഷയമാണ്. അതുകൊണ്ട് ഈ കോവിഡിന്റെ സമയത്ത് ലോക പ്രമേഹ ദിനം നമ്മൾ ആചരിക്കുമ്പോൾ അതിന് ഒരുപാട് അർത്ഥ തലങ്ങളുണ്ട് എന്ന് ഞാൻ സൂചിപ്പിക്കുകയാണ്. മറ്റൊരു കാര്യം, ഈ കേരളത്തിൽ തന്നെ നമ്മൾ നേരത്തെ സൂചിപ്പിച്ച ഇന്ത്യയിലെ ഏതാണ്ട് 21% ആളുകളും പ്രമേഹ രോഗികളും കേരളത്തിലാണ് എന്ന് പറയുമ്പോൾ ഈ 21% ആളുകളിലും ഏതാണ്ട് 10% ആളുകൾ മാത്രമാണ് ഈ പ്രമേഹ രോഗത്തെ നിയന്ത്രിക്കാനായിട്ട് വേണ്ടുന്ന ജീവിത ശൈലിയിൽ മാറ്റങ്ങൾ വരുത്തുക, അല്ലെങ്കിൽ അതിന്റെ മരുന്നുകൾ കഴിക്കുക, ജീവിതശൈലി മാറ്റങ്ങൾ വരുത്തുക, ഭക്ഷണക്രമത്തില്, വ്യായാമത്തില്, അതൊക്കെ വളരെ ശ്രദ്ധയോടുകൂടി ചെയ്യുന്ന ആളുകൾ ഏതാണ്ട് 10% മാത്രമേ. അപ്പൊ ബാക്കി ആ 11% ആളുകളും ഈ കാര്യത്തിലൊന്നും വലിയ ശ്രദ്ധ കൊടുക്കാതെയാണ് ഇന്നും നമ്മുടെ നാട്ടിൽ ജീവിക്കുന്നത് എന്നുള്ളത് അലാർമിംഗ് ആയിട്ടുള്ള ഒരു വസ്തുതയാണ്. അതേ സമയത്ത് നമുക്കറിയാം ഇത് നിയന്ത്രിക്കാനായിട്ട് ഡോക്ടേഴ്സ് പറയുന്ന കാര്യങ്ങൾ കൃത്യമായിട്ട് ചെയ്യാനായിട്ട് നമുക്ക് സാധിച്ചാൽ ഇത് നിയന്ത്രിക്കാനായിട്ട് വലിയ ബുദ്ധിമുട്ടുള്ള കാര്യമല്ല. നമ്മൾ മനസ്സ് വെച്ചാൽ നമ്മുടെ ജീവിതശൈലിയിലെ മാറ്റങ്ങൾ വഴിയായിട്ട് എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ഭക്ഷണക്രമത്തില്, വ്യായാമത്തില് ഒക്കെയുള്ള മാറ്റങ്ങൾ വഴിയായിട്ട്, മരുന്നുകൾ കൃത്യമായിട്ട് കഴിക്കുന്നത് വഴിയായിട്ട്, അപ്ലൈ ചെയ്യുന്ന വഴിയായിട്ടൊക്കെ ഇതില് ഒരു പ്രമേഹ രോഗിയാണെങ്കിൽ കൂടിയും അത് കൺട്രോളിൽ നിർത്തി വളരെ സന്തോഷകരമായിട്ടുള്ള ജീവിതം നയിക്കാനായിട്ട്, ക്വാളിറ്റിയുള്ള ഒരു ജീവിതം നയിക്കാനായിട്ട് നമുക്ക് സാധിക്കുമെന്നിരിക്കെയാണ് ഇത്രയും ശതമാനം ആളുകൾ, നല്ലൊരു ശതമാനം ആളുകൾ, കേരളത്തിലെ കണക്കുകൾ ശരിയാണെന്നുണ്ടെങ്കിൽ കേരളത്തിലെ പ്രമേഹ രോഗികളായിട്ടുള്ള ഒരു പകുതിയിലേറെ പേര് വലിയ ശ്രദ്ധ ഈ കാര്യത്തിൽ കൊടുക്കാതെ ജീവിക്കുന്നത്. അതുകൊണ്ട് തന്നെയാണ് ഇന്ന് ഈ ലോക പ്രമേഹ ദിനം നമ്മള് വളരെ കാര്യമായി തന്നെ ആഘോഷിക്കേണ്ട ഒന്നായിട്ട് മാറുന്നത്. കോവിഡിന്റെ സമയമാണ് നമുക്കറിയാം. നേരത്തെ ഷബീർ സാർ സൂചിപ്പിച്ചു, നമ്മള് ഒരർത്ഥത്തില് സാധാരണ ഈ ആശുപത്രിയിൽ എല്ലാവരും ഉള്ള സമയമാണെന്നുണ്ടെങ്കിൽ എങ്ങനെയാണ് നമ്മളത് ആഘോഷിക്കാറുള്ളത് നമുക്കറിയാം. ഒരു ദിവസം നീണ്ടു നിൽക്കുന്ന പരിപാടികളാണ്. എല്ലാവരും വളരെ ആഘോഷപൂർവ്വം സന്തോഷത്തോടുകൂടി ഒരുമിച്ച് ചെയ്യുന്ന മനോഹരമായിട്ടുള്ള പരിപാടികളാണ്. പക്ഷെ ഇത്തവണ ഈ കോവിഡിന്റെ സാഹചര്യത്തിൽ നമ്മളൊക്കെ ഈ ഒരു വെബിനാറിലായിട്ടാണ് ഇതിന്റെ കാര്യങ്ങൾ ചിലത് നടത്തുന്നത്. പിന്നെ ഓൺലൈനായിട്ടാണ് പല മത്സരങ്ങൾ നടത്തുന്നത്. അവയർനെസ് പ്രോഗ്രാംസ് നടത്തുന്നതൊക്കെ ഓൺലൈനായിട്ടൊക്കെയാണ് നമുക്ക് നടത്താനായിട്ട് സാധിക്കുന്നത്. പക്ഷെ ഞാൻ പറഞ്ഞു വരുന്നത്, ഇത് നമ്മുടെ ആളുകളിൽ വലിയ ഒരു അവയർനെസ്, അവബോധം ഇതിനെപ്പറ്റി സൃഷ്ടിക്കുക എന്നുള്ളത് മരുന്നുകൾ പോലെ തന്നെ പ്രധാനപ്പെട്ട ഒരു കാര്യമാണ്. അപ്പൊ ആ മേഖലയിൽ പ്രത്യേകിച്ച് ഈ വർഷത്തെ ഈ വേൾഡ് ഡയബറ്റീസ് ഡേയുടെ തീം അത് നേഴ്സസ് ആൻഡ് ഡയബറ്റീസ്, നേഴ്സസ് മേക്ക് ദ ഡിഫറൻസ് എന്നുള്ളതാണ്. അതെനിക്ക് തോന്നുന്നു വളരെ വളരെ ഇമ്പാക്ട്ഫുൾ ആയിട്ടുള്ള ഒരു തീമാണ്. ഡോക്ടേഴ്സ് ഇതിന്റെ മുന്നണി പോരാളികളായിട്ടുണ്ട്. എന്നിരിക്കൽ തന്നെയും നമ്മൾ നേരത്തെ സൂചിപ്പിച്ചു, ഇത്രയേറെ ആളുകൾ ഈ കേരളത്തിലെ പ്രമേഹ രോഗികളിൽ പകുതിയിലേറെ പേര് അശ്രദ്ധമായി ജീവിക്കുന്നു. എല്ലാ സാഹചര്യങ്ങളും ഇതിനെ കൺട്രോൾ ചെയ്യാനായിട്ട്, എന്നിട്ട് ക്വാളിറ്റിയോടുകൂടി ജീവിക്കാനായിട്ടുള്ള എല്ലാ സാഹചര്യങ്ങളും നിലനിൽക്കെ അശ്രദ്ധയോടുകൂടി ജീവിക്കുന്നു എന്ന് വരുമ്പോൾ എനിക്ക് തോന്നുന്നു നേഴ്സസിനൊക്കെ കുറെ കൂടെ വലിയൊരു റോള് കേരളത്തിലെ പ്രമേഹ രോഗത്തെ നിയന്ത്രിക്കുന്നതിൽ, ആ പ്രമേഹ രോഗം ഉണ്ടായിട്ട് ജീവിക്കുമ്പോൾ പോലും ഒരു ക്വാളിറ്റി ലൈഫ്, സന്തോഷപ്രദമായിട്ടുള്ള ഗുണമേന്മയുള്ള ഒരു ജീവിതം നയിക്കാനായിട്ട് നേഴ്സസിനൊക്കെ ഒരുപാട് കോൺട്രിബ്യൂട്ട് ചെയ്യാനായിട്ട് സാധിക്കും എന്ന കാര്യത്തിൽ യാതൊരു സംശയവുമില്ല. അവരുടെ റോൾ വളരെ പ്രധാനപ്പെട്ടതാണ്. അതിനെപ്പറ്റി ഡോക്ടർ ഉഷ സംസാരിക്കും എന്ന് എനിക്കറിയാം. അപ്പൊ ഈ അവസരത്തിൽ ഞാൻ എല്ലാ ആശംസകളും നേരുകയാണ് ഇന്നത്തെ ഈ ദിനത്തിന്. ഇന്നത്തെ ഈ ദിനത്തിൽ നടക്കാനിരിക്കുന്ന എല്ലാ പരിപാടികൾക്കും എല്ലാ വിജയങ്ങളും നേരുകയാണ്. നമുക്ക് എല്ലാവർക്കും അറിയാവുന്നതുപോലെ ലിസി ആശുപത്രി ഈ കേരളത്തിലെ ഈ ഡയബറ്റീസിന്റെ നിയന്ത്രണ കാര്യങ്ങളിൽ വളരെ ശ്രദ്ധയോടുകൂടിയാണ് എല്ലാ കാര്യങ്ങളും ചെയ്യുന്നത്. നമുക്ക് മികച്ച ഒരു മെഡിക്കൽ ടീം നമുക്കുണ്ട്. ഡോക്ടർ അരുൺ മേനോൻ ഈ അടുത്ത കാലത്താണ് നമ്മുടെ കുടുംബത്തിലേക്ക് കടന്നു വന്നത്. ഈ കുറഞ്ഞ നാളുകൾ കൊണ്ട് തന്നെ വളരെയേറെ പോസിറ്റീവ് ഇമ്പാക്ട് നമ്മുടെ ആശുപത്രിയിലും പ്രമേഹ രോഗികളുടെ, ഇവിടേക്ക് കടന്നു വരുന്ന പ്രമേഹ രോഗികളുടെ കാര്യത്തിലും ഈ എൻഡോക്രിനോളജി അത് വളരെ ഒരു സൂപ്പർ സ്പെഷ്യാലിറ്റിയാണ്. ആ മേഖലയിൽ ഒരു മെഡിക്കൽ ഫ്രട്ടേണിറ്റിയിൽ തന്നെ ആ പ്രവർത്തനങ്ങൾക്ക് നേതൃത്വം നൽകുന്ന ഒരാളാണ്. അസോസിയേഷനും കാര്യങ്ങളിലൊക്കെ അതിന് നേതൃത്വം നൽകുന്ന ഒരു വ്യക്തിത്വം കൂടിയാണ് ഡോക്ടർ അരുൺ എസ് മേനോന്റെ. അപ്പൊ അദ്ദേഹത്തെ പോലെ വളരെ മിടുക്കരായിട്ടുള്ള ഡോക്ടേഴ്സിന്റെ നേതൃത്വം, അതുപോലെ ഡോക്ടർ ജോർജ് പൗലോസ് വർഷങ്ങളായിട്ട് നമ്മുടെ ഡയബറ്റീസ് ഡിപ്പാർട്ട്മെന്റ് അദ്ദേഹം കൈകാര്യം ചെയ്യുന്നു. എത്രയോ പേർക്കാണ് ആശ്വാസം നൽകി അദ്ദേഹത്തിന്റെ ഈ നാടുകളിലൊക്കെ അദ്ദേഹം ഇവിടെ ആയിരുന്നിട്ടുള്ളത്. ഡോക്ടർ ബെറ്റ്സി ഉണ്ട്, അവരുടെ ജനറൽ മെഡിസിന്റെ ടീം സപ്പോർട്ട് ചെയ്യാനായിട്ടുണ്ട്. അങ്ങനെ ഒരു മികച്ച ഒരു മെഡിക്കൽ ടീം തന്നെ നമുക്ക് ലിസി ആശുപത്രിയിലുണ്ട്. ഈ മേഖലയിൽ പ്രവർത്തിക്കാനായിട്ട് നമ്മൾ വളരെയേറെ പ്രാധാന്യം അതിന് നൽകുന്നുണ്ട് ഭാവിയിലും. കാരണം നമ്മൾ നേരത്തെ സൂചിപ്പിച്ചു, നമ്മള് ഇതൊരു ഡയബറ്റീസിന്റെ ക്യാപിറ്റൽ എന്ന് പറയുമ്പോൾ നമ്മൾ ഒരുപാട് നമുക്ക് ഈ മേഖലയിൽ ചെയ്യാനായിട്ടുണ്ട്. ആ കാര്യത്തിൽ ലിസി ആശുപത്രി പ്രതിജ്ഞാബദ്ധരാണ്. ഭാവിയിലേക്ക് പോകുമ്പോഴും വേണ്ടുന്ന എല്ലാ കാര്യങ്ങളും, എല്ലാ സപ്പോർട്ടും ഈ മെഡിക്കൽ ടീമിന് ചെയ്ത് ഈ മേഖലയിൽ മുന്നോട്ട് നമ്മൾ പോകും എന്നുള്ള കാര്യം ഈ അവസരത്തിൽ സന്തോഷത്തോടെ അറിയിക്കുകയാണ്. എല്ലാ ആശംസകളും ഈ ദിനത്തിന് നേരുന്നു. വളരെ എല്ലാവർക്കും ഒരു അവബോധം, ഈ മേഖലയിൽ അവബോധം എല്ലാവരിലും ജനിപ്പിക്കാനായി, അങ്ങനെ ഈ സ്റ്റുഡൻസിനെ സംബന്ധിച്ചിടത്തോളം മുന്നോട്ട് പോകുമ്പോഴത്തേക്ക് വ്യക്തമായിട്ടുള്ള ജീവിത ശൈലി, അച്ചടക്കമുള്ള ജീവിത ശൈലി സ്വീകരിക്കാൻ നിങ്ങളുടെ കുടുംബങ്ങളിലും നിങ്ങൾ കണ്ടുമുട്ടുന്ന രോഗികളിലുമൊക്കെ അവരെ ഈ മേഖലയിൽ സഹായിക്കുന്ന കാര്യങ്ങൾ ചെയ്യാൻ വേണ്ടുന്ന എല്ലാ ആശംസകളും നിങ്ങൾക്ക് എല്ലാവർക്കും നേർന്നുകൊണ്ട് ഇന്നത്തെ ഈ ലോക പ്രമേഹ ദിനം, വേൾഡ് ഡയബറ്റീസ് ഡേ യുടെ ആഘോഷങ്ങൾ, നമ്മുടെ ലിസി ആശുപത്രിയുടെ ഈ ആഘോഷങ്ങൾ ഉദ്ഘാടനം ചെയ്യുന്നതായിട്ട് പ്രഖ്യാപിച്ചുകൊണ്ട് ഞാൻ എന്റെ വാക്കുകൾ നിർത്തുന്നു. നന്ദി, നമസ്കാരം.
Thank you. May God give you courage and shower on you His blessings in each and every step you take. We shower flowers of gratitude on you, Father. We believe that today's education is tomorrow's future of every single person. We are delighted to have these good speakers with us. Their presence is our honor. We heartily welcome all of you today. Dr. Arun S Menon, consultant endocrinologist, Lisie Hospital. We are equally honored to have you with us today here. May I now request Dr. Arun to bring us to the reality from the dream world through permanent cure for diabetes. I welcome you, sir.
Okay, thank you, everyone. Can you hear me? Am I
Yes,
audible?
sir.
And
Yes,
can you
sir.
see my slides as well?
Yes, perfectly.
Okay, thank you so much. Thank you. So, good morning, everyone. Respected Reverend Father Jery, Dr. Shabeer, Dr. Usha, rest of the faculty, and my dear students. So, I think it's a very, very important day, and I think the start has been very good. Both Dr. Shabeer and Reverend Father Jery really told us the importance of diabetes and the importance of having such a day or celebrating such a day. The reason being that we all know the importance of diabetes and how much problems that diabetes is causing to all of us. And what I will try and do is, I think, unfortunately, Dr. George Paulus, sir, is unable to join us. I think it's, as you know, it's a very busy time on the wards with COVID and COVID patients and all that. So I will try and deal with the importance of education. Perhaps I haven't actually made slides for the permanent cure sort of thing. I'll probably, if I have time, I'll just quickly go through that as well. And if time permits, I'm quite happy to take a few questions and discuss, but that again is up to the organizers to decide whether there is time enough for that. Because I realize that it's already 9:20. So I'll try and confine my talk to about 30 minutes or so. It's okay for me to speak in English for the next half an hour, is it? Or or is it best for me to just mix English and Malayalam? Whichever it is, I'll just go on. I'm sure you're all fine with that. So, as Father was saying, I think Father struck upon so many important points when it comes to diabetes. He talked about the relevance of diabetes in today's world, the fact that we all know about diabetes. In fact, our patients know very much about diabetes. Unfortunately, they still don't act on it. So the question really is, it's all good giving all this education, but why is it that people are unable to follow or take leads from this education and do something about their diabetes? Because as Father was saying, it is still startling to see patients come in with extremely poor control. Many a times they're fooling themselves and fooling us by saying that they're taking, they will say, oh, my diet is okay. I'm exercising. I am taking my medications. I'm doing everything. And then you start to ask them, because you really need to spend time with many of these patients, which is unfortunately something that almost all of us don't have, isn't it? Whether that be nurses, doctors, other educators, time is always at a premium, and we all struggle to spend time with our patients. I know that's not ideal, that's not right, but it's a fact that we just don't have enough time. Why do I say this? It is easy for us to just give education leaflets or just give them in 5 minutes all the problems that diabetes will cause. It goes through one ear and goes out through the other ear for the patient. And many times their attitude is, yeah, we have heard all these things. People who have had diabetes for say 20 years, they will say, oh, every year different doctors have told me the same thing. But then why is it that they're unable to do it? So I think it is time that we move, at least in Kerala. I'm not talking about the rest of India. That is different. The educational level is different. The attitudes of people are different. But if you take a place like Kerala, where education is certainly a strong point, unfortunately, what you see is there's a lot of misconceptions. There's lot of wrong education. So I've already actually started to think now that we are not talking about education. We are talking about de-educating and then re-educating many people, because many a times people come with very wrong concepts about the disease, very wrong understanding about what they should be doing, and they do all the wrong things. I'm not saying all wrong things. I think probably I should correct myself. Many times they do many things wrong. And where have they picked this up from? They don't know. So if you ask them, who told you this? They'll say, oh, I'm not sure. I think I saw it in WhatsApp, or one of my neighbors told. Or so unfortunately, people are getting this information from the wrong places. So more and more, our discussion is about the wrong concepts that they have, actually breaking that off and then giving them the right information. What is it? I mean, I think it is important to be honest in our profession, in the sense that we have to tell them the truth. So we should tell them what we know. We should tell them things that if we don't know, we should be telling them very clearly that we don't know. And I think that is one thing, that honesty in our profession is something which we have all, strive to keep up with, isn't it? Because we don't have all the answers. None of us would ever say that we have all the answers. So when you're educating a patient, I think we have to be very honest and say, okay, these are the things we know. This is what you can do. And then there are about 10 questions they will come up with. Oh, can I have this? Can I have that? If I take some weird concoction, will that be okay? Should I take this medicine? Should I take that? So I think we can be very, very honest and say, okay, these are the things we know. If you don't know something, I think we should be honest and tell them that, because that is, I think, very important. That's a good starting point for educating patients. So I think that's my start. And World Diabetes Day is, why do we have World Diabetes Day? It is really just to bring back that focus back to diabetes. The last few years has been a very relevant topic. I mean, last year I remember giving a talk on that was on the family and diabetes. And I think perhaps that's the most important aspect in diabetes. The support that a family, when you say family, it is just not family, friends, people around you, the society. The kind of support that the family gives to a person actually makes a huge difference to diabetes and diabetes management. And that was the last year's topic. And I think they did it for 2 years. And I think that remains relevant. So when we talk about this year's theme, I think all this, so you're adding up, it's like building blocks on this thing. It's not a different topic we are talking about. So here we are talking about how the nurses can make a difference. The nurses do make a difference. We know that nurses make a difference in all aspects of medical care. They probably don't get the accolades they always get. Their role, as we all know, is probably more important than anybody else, including doctors. Because they are the people who spend most time with the patients. As an inpatient, when a patient is there, how much time does a doctor spend with a patient? A few minutes, isn't it, every day? Because that's all the doctors might have time for. Who spends most time with the patient? It's the nurses. It's the other allied health professionals. So when it comes to a chronic disease like diabetes, I think the most of the knowledge that the patient picks up is not from the doctor. It's not from the social media. The most of the knowledge would be picked up from people they meet often. That will be one, their family. Two, the professionals they meet in various walks of life, which is the nurses, the ASHA workers, the health workers. There's so many people they meet. All these people need to, I mean, it's a huge job for us to actually train all these people and make them ready to impart the right knowledge to the patients. I think that itself is the most difficult thing that we have in front of us. Why do I say this? This is because we know that if patients were willing and if they were ready to do the things that we know should be done, I'm talking about the changes in their lifestyle, changes in their diet and exercise, the medications. If 90% of our patients were able to do this, able to do the right things, I'm sure all this dialysis and heart problems and everything will come down. I'm not saying it will be eliminated, will significantly come down. Whereas the other way around, what are we seeing now? We are seeing that there's not enough dialysis units now because all dialysis units are full. You look at cardiothoracic and cardiac surgery OPs, they are the busiest in any hospital. You know, I remember when I started nearly 20 years back, there was hardly a cath lab in Cochin. And now there are about 20, 25 cath labs in Cochin, and everybody is busy. Now, this is not because people are just doing it for the sake of it. Patients are obviously going to the cardiologist because they're having problems, and almost more than half of them have diabetes. So clearly there is a huge problem that our society is facing. Dealing with it and dealing with a heart attack or a renal failure is good. It has to be done, but that's not enough. That is certainly not enough because people are struggling through these diseases. A huge share of the health expenses is being spent on these costly treatments. And after all this, what is the quality of life of patients once they go into dialysis or once they have bypass and all that? Not great, not great. So we all know prevention is what we need to do. And I think that is where we can all join together. So I think as Father was saying earlier, what is the prevalence of type 2 diabetes? I think when we say diabetes, we are talking about type 2 diabetes. Of course, I'm not going to go into type 1 and pancreatic and all that. That's a different set of problems. Why do we focus on type 2 diabetes? Because that is where our education, I'm not saying that education is not required for other types, but where education in terms of doing the right things from very early on. We are talking about schools. I mean, perhaps the best place to start this education is schools, because we know it is before you get this disease that you should have the knowledge. That is where you should make the corrections. So type 2 diabetes is where you can really make a difference. Type 2 diabetes is what is leading to this explosion of problems in patients, health problems in patients after the age of 50 or 60. Now you're seeing more and more patients with type 2 diabetes in the age of 30 or 40. So very, very young patients are coming in with heart attacks and problems. Why is that? Perhaps because the lifestyle from very early on. You're talking about 5-year or 10-year-old who have clearly I mean, you can't even call it a lifestyle. They just don't have a pattern. They don't have a pattern. Especially this COVID has probably made things worse. You know, there is no sleeping pattern. There's no eating pattern. They snack, they sit in front of TV, exercise. God knows what exercise means for them, because they will say, of course, I can't wear a mask and go out and do it. Of course, there are a lot of practical problems. So it is not finding a reason about this. It is finding a way out of all this, because all these challenges will keep on happening throughout our lifetime. It's not going to go away. It might be COVID today, it might be something else tomorrow, and I'm sure that is how it will go. So it is finding a solution to these problems in the midst of all this. That is what we are trying to do. So as Father was saying, more than 10% is what we are saying, the prevalence of type 2 diabetes in our country. And whatever data, limited data we have, it is clear that Kerala has got a much higher prevalence of this disease. Why is that? That is probably because we are much more switched on, and we are probably making more people, more diagnosis. More people are going to the doctors, more diagnosis being made. So at least that bit. So we are certainly, Kerala is forward in many areas when it comes to diabetes. There's a lot of progress that has been made, but there are a lot more that we can do. That is one. And the second thing is the aging population. So if you look at, compare ourselves with other metro cities or with other parts of India, our population is much more older. And then you can put in our dietary changes. And so it's not as simple as just our diet is bad or something like that. It's not. I think every local cuisine and every local diet has got its own strengths. Perhaps the fact that we are going away from our local cuisine and having more and more of, the kind of imported diets and imported food might be a problem. Again, that is something which we have to address. However, I think the important thing is that to know that we as a state has got a huge burden in terms of diabetes, and we are seeing it right in front of our eyes on an everyday basis. So I think the fact that people in the first years of type 2 diabetes, so what happens when somebody is diagnosed with diabetes? What we see for a fact is that they always look for a cure. So the moment somebody tells them, initially there's a denial. And I think this is the biggest problem that we face. And that applies to even health professions. So I have so many doctors who are my patients, including doctors from Lisie, who have in the last, I've only joined 4 months back, but in the 4 months, I probably have seen 10 or 15 of my colleagues who have type 2 diabetes and who actually deny it. So these are doctors, so senior doctors, because why do they deny it? Because they are busy, they feel perfectly fine. There are no symptoms. None of these people have any symptoms because they have, that is unfortunately one of the problems. And I say unfortunately, one of the problems with type 2 diabetes. Why do I say unfortunately? Because if we have symptoms, we will usually deal with it. When we don't have symptoms, when it's a silent disease, a silent killer, we don't realize it because it is priorities that matter in life, isn't it? We prioritize things, you know. So if you have a chest pain, I'm sure that you will, next minute you will go to the accident emergency or a cardiologist or whatever, because you know that chest pain, you can't wait till tomorrow or day after. Yeah. Whereas you have a ache and pain, but it's not, it's okay. You start walking and you feel okay. You think, okay, fine, I'll deal with it when it comes to. So, and especially if you don't have any symptoms like in diabetes, then you'll always think, okay, my sugar is 150. I'll check it 2 weeks later. 2 weeks later, you'll naturally forget because you don't have any symptoms. And then it'll be a month, it'll be a few months. And there are patients who come in and say, oh, my diagnosis, diabetes diagnosis was diagnosed only this week. And I usually ask, have you ever done a blood glucose before? Has it ever been raised? Yeah, it was done 2 years back. And the doctor did say that it's on the borderline, but then I didn't check it. So what is the reasoning for that? So when you find something that is wrong, and when you leave it for 2 years, then clearly it's not because of lack of knowledge. So people do understand that diabetes is a disease, it will progress and all that, but they just feel that it won't happen to them just because they don't have any symptoms. So I think that is the biggest problem. The fact that it's a silent disease is an issue, and which is why people are not addressing it. Now, as I said, the second problem is that they look for remission. You know, they want a cure. And anybody who can offer them a cure, people are happy. So people run behind all these sort of ads that you see where you say, you come to us in 10 days, we'll cure the diabetes for you. And what do? They will give you a strict diet and strict exercise. Naturally, if you give strict diet and strict exercise for 10 days or 2 weeks, the sugars will come down. We know that. And so then they will ask you to check your sugars are normal. They'll say, that's it. You're cured, you can go home. And what do people do? They go home, they never check their sugars, they go back to their old lifestyle. This is the problem. The problem is not that they don't do it, but they do it only for 2 weeks or 1 month. And after that, they just go back to their previous lifestyle. And then they forget for years. And later you find that they come back with even worse scenario where the sugars are very high or they've had an infection or something. And then it's a bad surprise for them. So they really are shocked to find that, or they'll say, oh no, I thought it was cured. So this cure, unfortunately, that is a word that we shouldn't be using. Sugars going back to normal is not a cure. That is just a control. And if you're able to keep that with whatever, if you can keep it with lifestyle alone in the normal range, well and good. But I think the message should be loud and clear to everybody. That includes your family, your patients, to everybody, that yes, good that your lifestyle is good and you're able to control your sugars now and sugars are normal, but don't expect the diabetes to go away. It will hide. It will be in the background. The moment you go back to old ways, then it will come back. Why? Because why did it happen in the first place? It happened in the first place because for some reason, your lifestyle was not right. Okay, there are so many other factors. There is a genetic factor. There's so many other factors, but the way by which you can control it is by your lifestyle, plus of course medicines that will come later. But that lifestyle, if you decide to go onto a lifestyle and continue and control it, you have to do that for the rest of your life. There's no reason for you to go back to your usual lifestyle. It will come back. And I think that message you need to tell them loud and clear from the beginning. Medications are important. And what I would say about medications is that many times patients will start taking medications. When the sugars normalize, they will stop it. Again, what is the reason for that? And their reasoning is, my sugars are normal. I thought that if I continue it, the sugars will go down. See, so clearly that is a lack of understanding of how medications work. We know what medications do is just control the sugars, and the moment you stop, in a few days time, it will go back. I just had a patient from Gulf. He's an engineer working in Gulf yesterday, one of the last patients I saw. So this is exactly what he was saying. So he was saying that whether I take medications or not, my sugars remain uncontrolled. Of course, sugars were not very well controlled. So I asked him, why do you say that? He says, I skip the medicine once in a while and then try, and the sugars remain same. I said, how long do you skip for? So I know I just skip 1 or 2 tablets and then see, and then the sugars remain the same. So why should I take this tablet? He still takes the tablets. So I said, see, this is wrong misconception, because medications, when you stop it, the effect of these medications can last for a week, sometimes even 10 days or so. So to know the true picture, you might have to stop it for weeks. We wouldn't advise them to stop it for weeks unless it is safe. But what I'm saying is, people make their own judgment about the disease just by stopping medicine for a day or skipping the medicine and say, oh, it doesn't make a difference. This medicine doesn't seem to be working in me. So rather than correcting their lifestyle or correcting or finding a new or consulting with a professional as to what they should do, they make their own assumption of how the body is responding to this medicines or their lifestyle. So these are difficult challenges, but I think something which we all have to continue to spend time with patients on to discuss. So when we talk about lifestyle, it is just not about diet and exercise alone. There's so many other things that patients don't tell you. I don't need to tell you about the effects of smoking. One of the reasons why cardiac disease has been up, although smoking has perhaps come down in our community, which is a good thing, there is still a long way to go there. Alcohol. I mean, the number of patients with chronic liver disease that comes to my clinic from our diabetes clinic, from the gastroenterology OP, it's immense, because most patients with liver disease after a few years will develop very badly controlled diabetes. And unfortunately, sugars are all over the place, and they just don't, after some time, they say the patients become desperate and they just don't care. Not everybody, but many of them. So alcohol is a huge problem, and it continues to be a huge problem. It causes fluctuations in sugars. The liver disease itself makes diabetes worse. So it is something which you have to discuss with patients from very early on. Now, many times we see these patients when the damage is already done. Then it's more damage limitation rather than prevention, isn't it? So it is important that we talk about these things very early on. Stress relief. Now, it's a talk in itself for perhaps a day or many days or whatever. And obviously, I'm not an expert in this area of how to deal with stress. If our director Achan was there, I think he would have probably been a good person to deal with the psychological aspects of this disease. I would just stress upon the fact that diabetes, when we look at it as a metabolic disease, as a vascular disease, it's a metabolic disease because there is this glucose problem, there is this hypertension, lipid problems, all these things, metabolic problems, thyroid problems, all those things. It's a vascular problem because it causes so many problems with blood vessels. Fine. It is also a disease in your mind. I think unless we accept that there's a huge psychological problem for most patients with diabetes. I'm not saying that they have a psychological problem by itself, but when they think about diabetes, when they are asked about diabetes, there is a lot of confusion in their mind. They don't know what to do. Many times they feel guilty that they're unable to do the things they want to do just because of the pressures of life. And that puts so much strain back on those patients. So addressing this, I don't think we still have got a good way of dealing with stress and stress-related issues in patients with diabetes. And it's an area we talk not much about, although we all know that that's probably one of the reasons why diabetes is so badly managed in our society. I think this message, I think I touched upon earlier, but the fact that not everyone will have symptoms. In fact, if you take type 2 diabetes, only a small proportion of people will have symptoms. And they have symptoms when the sugars are so poorly controlled that they have osmotic symptoms. So that is when the sugars are very high. So still, even in an educated society, 50% of the patients who come to me will say, "Sir, okay, you say that the sugars are high, it's 200, 300, but I'm fine. I don't have any symptoms. So is this all right? Is it the problem with the glucometer? Is your lab right? Is the lab I checked outside, is there a problem with the lab?" So people, query about almost everything else just because they don't have symptoms. So I think that you have to impress upon patients that don't wait for symptoms. You may never have symptoms. And the first symptom you might have might be a chest pain, or might be a swelling of your feet, which might be due to kidney problem, or a blindness, which means your eye disease has progressed for years and years. So don't wait for that. That's a wrong kind of understanding of diabetes. And I think this is something which we need to tell patients. So what is the key to successful management of diabetes? All these points, I've touched upon some of them. The importance of lifestyle, the importance of checking the sugars regularly, something which is very difficult to convince patients about, because they are, it's a satisfaction thing, isn't it? When you see a sugar of 100 and 130, then you don't want to check it for frequently, because it's like a magic figure, it's like a magic figure you have got. And you want to live with that for as long as you can. So you ask patients, when did you last do the sugars? I did 2 months back. Yeah, but at that time it was perfect. Yeah, but that was 2 months back. So what happened after that? What was it last month? What was it last week? Was that okay? See, so knowing that helps, isn't it? I mean, knowing that will help you. Even if then they will say, there's no point, doctor. But whenever I check, it has been normal. But there are times when it can go wrong. And unfortunately, when it goes wrong, it won't give you symptoms. I think that is what people need to understand. Regular monitoring of complications. As I said, for diabetes per se, all these complications, again, the issue is that I think I'll probably stick to maybe 5 to 10 minutes. Otherwise, I keep on talking. So because this is a very vast topic and you can go on, but I'll probably in the next 5 to 10 minutes, I'll try and conclude. Otherwise, it might go on too long. But so the complications is again very silent. So you have to continue to screen patients. And when we talk about complications, we are talking about the microvascular complications, which is the complications that affect the eyes, that affect the feet, the nerves and the circulation and your eyesight. Then we talk about the macrovascular disease, which is your heart and your blood vessels to the brain and your blood vessels to the kidneys and all that. So all these are silent most of the time, and unless you do regular checking and you go and you ask the patients to go and have regular screening at least once a year, many of these things are missed. So all these things, unfortunately, sitting in a clinic, you can't expect a doctor to just, we always say this, but I'm sure the patients don't get all this information because everything is in a hurry. You see them for 5 to 10 minutes every 6 months. What's the point? You can't. So we have to find ways, and I think collectively, I'm not talking about just the doctors, all of us have a responsibility to our society. We all have to find ways by which we can spread this information, send this information from authentic sources, not just by just word of mouth, or by authentic sources, as well as through our family and from our friends, through our friends, to get this right information to our patients. So I think many of these I'll skip. I am not going to go into the nitty-gritties and the details of all these aspects. I've talked about the diabetic foot, which is actually a huge problem, and I think it is something which many of us may not be realizing, because we don't see that many cases. We see a few here and there, but unfortunately, the amputations have not come down. We are talking about minor amputations as well as major amputation. And you know the impact that an amputation causes on a patient's life. And this has a huge effect on the family as well as society. So all of us dread when we talk about cancers, because cancers, we know how much it affects that person, the family, and how much expensive it is treatment-wise. What we see is diabetes pretty much does the same thing. If you develop a foot problem or a kidney problem, it's the same effect. Your job goes, your family is in trouble, your expenses, your finance goes. So it's a huge problem in itself. So I think we need to impart knowledge about all these things. So again, as I said, for want of time, I'm not going to go into each of these details, but I think you should go with the understanding that we have to impart all this knowledge to patients. Unfortunately, just telling them once or twice is not enough, because they will not get all the information. So we have to collectively find ways. So every opportunity should be seen. So any opportunity, the opportunity where you see, as it might be in your hospital, in your clinic, in the ward, it might be in your home, it might be in a society. You might be giving a lecture or a talk in your community, or in your household, or in your small community. Wherever you get a chance, I think you should always take that opportunity. Give it. That's because people will always say, "Oh yeah, we know everything about diabetes. You don't need to tell us. There's nothing new. We have all heard, WhatsApp has told us all these things, so we all know." But the moment you start talking to them, they realize that they don't. Many times, even the simple, straightforward messages they don't have. They have wrong information. They have complicated information. So we have to simplify and give them the right information. So I'll skip any of these slides because I think time is an issue. But I think I'll stop with this important few slides, which is the importance of diabetes self-education. And I think this is where we all have a role to play. None of us are experts in this area, but it is empowering patients. I think that is the word that you should take home again from this talk. It is about empowering patients. This is not a disease that can be managed by health professionals alone. It is a disease that has to be managed by the patient or by that person. That person needs to be given all the information, all the armamentarium, or as much of information as we can. That person has to be given all the support we can. We have to find that balance. We have to give that information, and then that person has to make an informed choice. So that is other word, informed choice. So many times they are making the wrong choices because they don't have the right information. We have to find ways by which we can educate these patients, give them the information, the right information, and then it's for them to make the choice, whether that be the change in lifestyle or medications or whatever that be. Sorry, I just, so in that aspect, I think all of us have a role to play. I think that is so, although this year, we are talking about nurses' role, there is a role that each and every one of you listening to me today has a role to play. And I have absolutely no doubt about this, because this is not a disease that should be managed by one doctor or a specialist or whatever. It's not. Unfortunately, it's not. We will only be able to manage 1% or less than 1% of the population by our expertise. This disease can only be managed by all of us together, having the right information, having the right skills. So skill development is the most important thing. Now, when it comes to the patients, you have to understand the patient's personality trait. So as I said earlier, the side that we don't talk about, the psychological side of the patient, what is the patient's understanding? Is the patient in denial? Why is the patient? So the patient, you see so many patients, isn't it? They are so good in advising their relatives. They will advise the relatives, they will advise their friends, they will advise everybody. There was even one patient who came and advised me, just last week. So they told me, so sir, do you know that this, if you take this and this and this, these are all, some food items. If you take all this together, the sugars will come down. I said, I'm not sure. Okay, maybe all these are good items, but he said, yeah. He said, yeah, I've tried all this and it actually brings down the sugar. So you can tell your patients. So it's free advice that he gave me. Now, unfortunately, his HbA1c was 9%. So he is forgetting the fact that he has got a disease to live with, which is causing problems in him. And he was happy to advise me. And I took it, smiling and said, fine, yeah, if I think it's appropriate, I'll pass on with it. Unfortunately, he was happy that he could advise me. But unfortunately, I don't think he gained anything from that consult. Now, The assessment of family support, I talked about the role of family. I think that's a hugely important area. And the other thing is the health beliefs, which many people, as I've, again, over this talk, I've impressed upon the fact that the beliefs of patients are very important. So I think we have a role to actually form these beliefs in patients, the right beliefs, of what this disease is. Keep it simple, get the right messages. You don't have to overcomplicate things. Of course, if you run into problems, you need all the health professionals and all healthcare. But till then, I think the important thing is that you stick to basics and do what is right. And most of our patients can actually lead a very healthy life, lead a very positive life if they were to do that. And our role, I think I can't overemphasize our role in something like this. And all of us have to take a lead in this and try and make sure that we educate the right things, not the wrong information. Any evidence that if people say that, oh, I heard it like this, you always tell them, if you're not sure, tell them, I would like you to go and check this fact before you pass it on to others. Just don't, it's easy to pass an information by WhatsApp to 100 people. But many times you don't check and find out whether the information you are passing is the right information. And it's so easy these days. And if you go into Google, put this information, see, you will know that the 1 or 2 people would have put it. But by whatever knowledge we have about in science, these things might be wrong. So before we simply send information, before simply passing on information, we should be equipped with the right information. And then it is our job to pass it on in the right way to everyone. Thank you. I'll stop there. I think I've taken enough time. So it's 10 o'clock, nearly 10 o'clock. So thank you.
Thank you, sir, for sharing your inspiring words, and that could definitely inspire each one of us to change our daily lifestyle, and the cure is in our hands. A teacher is guide, an engineer, a philosopher. A true teacher, Dr. Usha Marath, Principal, Lisie College of Nursing, is here to adorn the day with the theme of the year, the nurse and diabetes. Now, I request Usha Madam to share her precious thought on this theme. I welcome you, Madam.
Excuse me, Madam. Welcome. Before that, Dr. Arun sirna ee session കഴിയുന്നവരെ convenient ആയിരിക്കുമല്ല കുട്ടികൾ സംശയം ചോദിക്കാൻ ഇപ്പൊ കൊടുക്കണോ?
Yeah, I think I've got an OP and I've, so I'm actually connecting from home. So I need to go back to hospital and start. So I would like to leave in another 5 minutes or so, if that's okay. I'm sorry that...
The questions can come up right now then.
Yeah, that's what I am thinking, madam. If you have
so maybe we can just give 5 minutes, isn't it? I mean, it's 9:57, maybe at 10:05 or something. So if you have any burning questions, any few questions, then maybe we can discuss that. I'm sorry that time is a problem. Just that I haven't cancelled my clinic being Saturday.
Yes, understood. Students, ആർക്കെങ്കിലും എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടെങ്കിൽ ഒന്നെങ്കിൽ ഹാൻഡ് റൈസ് ചെയ്യാം, ഇല്ലെങ്കിൽ നിങ്ങൾക്ക് അൺമ്യൂട്ട് ചെയ്യാം. പറഞ്ഞാൽ മതി, ഇവിടെ അൺമ്യൂട്ട് ചെയ്തു തരാം. ആർക്കെങ്കിലും ഡൗട്ട് ഉണ്ടെങ്കിൽ സൂമിൽ തന്നെ നിങ്ങൾക്ക് ഹാൻഡ് റൈസ് ചെയ്യാവുന്നതാണ്, അൺമ്യൂട്ട് ചെയ്തു തരാം, ഇല്ലെങ്കിൽ നിങ്ങൾക്ക് സെൽഫായിട്ട് അൺമ്യൂട്ട് ചെയ്യാം.
So I think Dr. Shabeer, Dr. Usha, we should, I mean, I know we haven't met personally. We'll hopefully do that in the next few months or few weeks or few months. I mean, the COVID is why we are all hiding. I think we should certainly look at these sort of programs, of course, but more importantly, some sort of educational program for our patients, especially when this COVID protocol is over. I don't think, I mean, I am very honest in telling my limitations, that I don't think a department in a tertiary hospital alone can address the needs of a patient. We can address the need of patient in terms of when they have a complication or a problem, but not the kind of education that we can impart. And there's a huge role that students and faculty and everybody from all allied specialties can do in this area, especially, I mean, nursing students as well as lab technicians, because lab technicians, I think that area has become very important, because when you think of it, almost every patient would meet lab technicians, isn't it? They go and talk to, when they give blood, they're meeting them. So or the other way around, people in the lab are meeting patients almost on a daily basis, so many patients. And many times patients will ask them questions. So they'll ask, so what is this result? So it is showing 110. They will say, is your lab right? Last time I did it was only 16. It was, it was 90. This time you're saying it's 160. So these are opportunities. I mean, we have to be opportunistic. These are opportunities for us to give knowledge, the right knowledge to them. I think we should look at programs of some sort, simple things, to give more education to patients. And it could be projects that some of our students do, or your students do, I mean. So I think there are areas there where we can work together. And that is just my thought at this point.
Sure, sir. Sure, sir. We can discuss it and we can implement accordingly.
Yeah.
Sure. I think then if there is no questions.
Yeah, I mean, again, if no questions, if there are questions, you can pass it on. I mean, the WhatsApp. So you can actually send it to Mila or one of your faculty, and they can pass it on if there are any burning questions. I'm sorry I'm unable to wait for too long, but thank you so much for having me. I'm sorry, Dr. Usha, that I have not waited for the important talk, because yours is the important talk. It is nurses and diabetes. That's today, that is going to be the most important. I would have loved to listen to you, but sorry, I have to leave at this point. So thank you all once again.
Thank you. Thank you, Doctor.
Thank you. Thank you.
Thank you, sir. Sorry for the inconvenience caused. Now I invite Dr. Usha Marath, Principal, Lisie College of Nursing, is here with the theme, the nurse and diabetes. I welcome you, madam.
So yes, once again, good morning to one and all. It is indeed that Dr. Arun has started the session and has very briefly but concisely emphasized on the various areas which need emphasis in diabetes. As we can see, the number of people with diabetes is continuing to grow in the world. Irrespective of our identifying it as a major health hazard, still measures are being taken, but the growth rate is going on increasing. So it is seen as one of the NCDs. NCDs means the non-communicable diseases, which has become endemic in India. And as the prevalence has been rising, the government of India has taken certain proactive steps to tackle the situation. In this regard, the government of India has come up with a program called as the National Program for Diabetes, Cardiovascular Disease and Stroke. And this was introduced in 2010 with the aim to prevent risk factors which is associated with the development of non-communicable diseases. So this has been identified as a major health issue or health problem which the country will be facing, which will have to invest a lot of money in the process of treating patients who are coming under the non-communicable diseases, which includes cancer, cardiovascular disease, stroke, diabetes. So all these are coming under this purview of non-communicable diseases. So to achieve the particular goal of reducing the risk factors and thus leading to a lower level of development of the disease in the latest period of time, the most important thing which has been focused is the behavior change which has to take place in an individual. So as it is rightly told in the very beginning itself, and we all know, even a layperson knows this, that prevention is better than cure. Preventing an illness from occurring is definitely the best method of treatment. And here too in diabetes, prevention plays a very important role. But if we are looking into the way in which diabetes is getting identified at a later period of time, when the illness has occurred, and then we start about the process of treatment and the process of controlling the complications which can take place as a result of this diabetes, it is indeed becoming a huge task. And our major focus right now, if you look into, is being focused on to this particular issue. That is the treatment of diabetes, the control of the blood sugar levels, preventing the complication as much as possible, though it is not entirely possible to prevent the complication from occurring, maybe by delaying the occurrence of complication, I may put it in that way, and the early identification. But it is still nice to see that Kerala is the first state which has come up with the implementation of the national program, which has emphasized on prevention, diagnosis, and management at primary, secondary, and tertiary levels of healthcare. So here, in this regard, the Kerala model has come up with the ASHA workers in the community at the grassroots level being trained or being equipped to screen people and to identify persons with pre-diabetic conditions and diabetic conditions, and then to refer them to the higher authority, higher levels of care. But again, this is just like a medical model. The world has identified, if you see, the World Diabetes Day this year has rightly identified nurses to play a very important role in the prevention and treatment of diabetes mellitus. So nurses are identified as the largest group of healthcare professionals. If you look into the healthcare, even in any community, the nurses are the largest healthcare providers available. So according to the nursing and midwifery program at WHO, the WHO emphasizes that nurses play a central role in the promotion and prevention of the disease, treatment, and rehabilitation. Dr. Arun had, in his presentation, rightly pointed out that we need to target school children. We need to educate school children. And now, how can they be educated by nurses? We'll be just thinking of who are working in the hospital. It is here that we have to identify that nurses have a role to play, and it is not just the four walls of the hospital that their care is confined in. This is where the school health nurses play a very important role. The community health nurses who are working in the community play a very important role. So all sorts of nurses in developed country, if you look into the healthcare system, they have specialists, nurse practitioners, family nurse practitioners, clinical nurse specialists who are diabetes specialists, who work in their own independent areas in the community, catering to the needs of the population, helping in the prevention and early identification and treatment of this particular disease condition, thus delaying the process of the onset of complications and other matter, thus improving the quality of life of people with diabetes mellitus. So nurses, as we know, everybody at some point of time does have a contact with a nurse, and we nurses are being placed with a very convenient aspect, because during our course of curriculum, we are rigorously trained to give health education or health teaching to the patient, which is a part and parcel of nursing care. So if you look into any nursing care which is to be planned, the health teaching which is associated with the person's condition has also to be going in. But how far this is getting implemented in the current scenario? Dr. Arun has also pointed out a very important issue: lack of time. Overburdened with patients, overburdened with the technical aspects of care, the other factors which other jobs which occupy their time. Many nurses do not find adequate time to give this particular address to this particular issue. Not only I will say that it is lack of time, I think another aspect which is the attitude of the nurses. It is necessary that we need to once again look into our own attitudes. Are we concerned about health teaching as an important role of nurses? Or is it that we as nurses give this role to the doctors who are treating the patient, and because most of the time I see when a patient asks something to the nurse will say, particularly in the hospital settings, the nurse says, please ask the doctor. Please ask the doctor. Every time, what is this medicine? How should I take it? What is the complication? Is there any complication related to this medicine? What type of a diet I need to take? Can I exercise? Can I do anything? Such question when it comes in to the nurse. I have seen many a time the nurses telling, please ask the doctor. I just wonder why this is being told. Aren't they having the adequate knowledge to exercise their own judgment and give a reply to the particular question? If so, the nurses should go ahead with equipping themselves with adequate knowledge, because the basic components of diabetic care is being taught in the various courses. And I feel any graduate who passes out with a nursing degree or a diploma does have the minimum required amount of knowledge to impart the necessary education. But definitely, as evidences come in, as things change, the nurses need to equip themselves with the current knowledge in order to ensure that they impart the right knowledge to the person. Nursing also stands at a very important place of providing holistic approach to the health care of the persons, whether it be the persons in the hospitals, whether it be individuals or communities. A holistic approach is always taken up by nurses when they're addressing the patient's needs. And hence, the role of the nurse gets emphasized. So every nurse can make a contribution by becoming a part of the multidisciplinary team to address to diabetes, and I'll say not just diabetes, all non-communicable diseases, because cardiovascular disease, hypertension, stroke, cancer, all these are diseases which are having a lot of morbidity and mortality related to it. So it is better that this disease are addressed at any level. It may be addressed at the community level, it may be addressed at an individual level. In your capacity as an individual, when you are being approached by another person, you can play a role. And the role which the nurses can play will include a very important role, that is diabetes educator. If you look into developed countries, you can see that nurses are being equipped with additional certificate as diabetic educator, and they take up a prominent role in counseling the patient and also educating the patient about the disease conditions. So you can see over here that this particular thing is available in developed countries, but a particular role of a diabetic educator as such, as a title, is not available for nurses in Indian scenario. In Indian scenario, we don't have the nursing practitioners. Recently, the government has come up with a community health officer role. You can see that community health officer role has been created, and in many of the states of India, this role is being taken up by graduate nurses, where they have the independent level to some extent within the protocol to practice. And that has indeed brought about a significant change. That's what is being reported by the community health officers. So such important things which the government is right now identifying, I believe, will pave way to the prevention of diabetes and reducing or maybe flattening the curve, the growing curves of NCDs in the future. If nurses are, the expertise of this particular group of nurses are being utilized, and various policies and roles and positions are being identified right in the community, in the schools, because I just said about school health nurses, but I really wonder how many schools have school health nurses, the post of a school health nurse. And if there is a post of the school health nurse, is it filled up? So it's very, I don't think so. There are much posts of a school health nurse being available. And in those schools where it is available, are the nurses, school health nurses, taking up the role actively and doing the work which they are assigned to. So it requires a rigorous policy making, policy decisions coming up at the government level, in creating posts which will be making a significant impact on the public health aspects, because this is a public health purview, which we, particularly when we look into the prevention and promotion aspects of health, it goes into the public health area, which has to be emphasized. In countries, we have another area which has been highlighted, called as advanced caregivers. It is called as the advanced practice nurses. Here the nurses are being skillful enough in conducting different roles, carrying out examinations, screening the patients, prescribing treatment, following them up, communicating with physicians, and seeing to that the most appropriate care is being provided to the person. But again, this role is yet to come up in the Indian scenario. And I'm very happy to say that in 2008, I believe, when the first batch of my BSc nursing students were graduating, I happened to come across a program called as the Diabetic Educator. It's not the formal thing, but it is a certificate program was there, which was being imparted by Vellore, CMC Vellore. I found that a few of my students were very much interested in when I talked to them about it, and a few of them did go for it and complete it successfully. But again, when the students came back to me, I found that they were really very dejected and very unhappy, because they were saying that in spite of their having this degree and in spite of their requesting in various hospitals for a post of a diabetes educator or a diabetic counselor, it was not at all given to them, and saying that this post doesn't exist. So such type of, I feel they would have been a best possible type of a diabetic counselor available in a hospital if they had been appointed. But to see that it was not getting exploited, the students lost their motivation to go ahead with such program. So that's the third role which I'm coming to, motivation. It is not just that the educators need to motivate the students to go ahead with such program. The motivation of the patients, Dr. Arun has rightly pointed out that in spite of giving a lot of teaching to them in the clinical setting, when they come to the clinics, they fail to comply with or the particular suggestions which has been put to them. And it's because of the lack of motivation they have. It's because of the lot of other extraneous factors which may sometimes dissuade them from the path, and they may be taking different approaches to help, because anyone suggesting them any method which is easier, they may take up those methods to control their problem, which may sometimes land them into a graver problem than before. So it is always necessary to uplift the motivation of the patient, and motivation doesn't come with just a single 5 minutes of talk with the patient will not lead to motivation. Motivation comes only when there is a constant support given to the patient by the healthcare providers, and in all their problems, whenever they have a problem at a particular point of time, whether it be at home or anywhere, the accessibility to the healthcare providers, if it is there, then only the persons will be ready to accept and have trust in what the healthcare providers are saying, and they believe in it, and they'll be ready to do it. So for that, we need a huge number of persons being employed for that particular aspect. So right from the community, it will be necessary that the care, it is not becoming hospital oriented, because right now the diabetic care is becoming more of a hospital oriented tertiary care aspects. It should not be like that. It should be coming to the community level, go back to the community level, and the self-management of diabetes mellitus is more important, and the need to enhance measures which will help the person or empower the patient to, that's the right word which Dr. Arun, and I'm using his word, to empower the patients to manage their own condition and take critical decisions related to the problem in a successful manner. So main barriers which I have found, which pose difficulty for nurses in diabetic care is, the first one, which I told, a very important one, is lack of knowledge. If it is lack of knowledge, then definitely nurses need to equip themselves. The nurse managers or their superiors or persons responsible for in hierarchy should make sure that some educational program is being given to them, so that they're equipped with the adequate knowledge, so that they can address the issues of the patient at the right time. The second one is lack of resources. As I told you, lack of resources in the form of personnel, lack of resources in the form of time, lack of resources in the form of money, money and material. All these three resources should be available in order to tackle a huge number of patients, because India as a country is a very huge country with a large number of persons getting affected. And if we have to play a role in preventing the occurrence or reducing the development of diabetes mellitus, it should start with the role of prevention at the grassroots level, employing more people at the grassroots level to address to the health needs. So it requires a lot of human resources coming in, which requires a lot of policy decision making and also the development of the health infrastructure. So these will be some of the challenges which come forth when we think of diabetes being addressed. Nurses definitely are being privileged and placed in a better position as they come into more contact with the patient. They're able to get more trust from the patient. They're more able to influence the decision making of the patient because they have a constant contact with them. They can understand the patient's need very well and help them in making the decision for themselves. So I believe India has witnessed a major shift in morbidity to non-communicable diseases in the last few decades. So the service delivery of which was right now available in the form of hospital-centered needs to be changed. Integrating the 19 million nurse and midwifery personnels with public health efforts to address to the non-communicable disease is going to be a critical factor in promoting health and preventing and reducing the occurrence of non-communicable diseases. So I believe that such activities can be carried out, and definitely nurses can play a role, and it is good enough to recognize that nurses are being recognized and given their due share in preventing this particular disease, which is going to have a great impact on the human population. So on this particular day, I feel the prevalence of diabetes as it is rising, we need to focus that everyone needs to make their own impact. And as nurses, I believe I'll call upon all nurses, whether they be working in any of the setting, to take this at their heart, to see that every opportunity they get to educate, to talk on, they make use of it, and they impart the right knowledge, help in order to break off the myths which the person may be having, or the wrong information which the patient may be having, and thus to make a change, and let the change start with you. Thank you.
Thank you, madam. We are honored and privileged to have you with us today. Let us express our sincere thanks to each and everyone. Our third year BSc MLT student, Ebin Amalekh, is here with wonderful bouquets of gratitude.
Okay, sir. Am I audible?
Yes, proceed.
Okay. Good morning to all. I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion on behalf of Lisie College of Allied Health Sciences. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. Next, I would like to thank Reverend Father Jery, Assistant Director, Lisie Hospital, Lisie Medical and Education Institution, for his inaugural address and words of encouragement. His able guidance has always encouraged us. Along with this, I would like to thank our Director Father Paul Carridan and other Assistant Directors in their absence, and the whole Lisie management for providing all support for conducting the Diabetes Day program. Next, I would like to thank our distinguished speaker, Dr. Arun S Menon, Consultant Endocrinologist, Lisie Hospital, who despite his busy schedule has found time to occasion by his very much informative session on importance of patient education in management of diabetes. Thank you, sir, for your wonderful session. Along with this, I would like to thank Dr. George Paulos, Senior Consultant Physician and Diabetologist in his absence. Next, I would like to thank Dr. Usha Marath, Principal, Lisie College of Nursing, for his wonderful talk based on the theme of year 2K20, the nurse and diabetes. Thank you, ma'am. Thank you, ma'am, for your valuable words. Next, I would like to thank Dr. Shabeer S Iqbal, Principal, Lisie College of Allied Health Sciences, for his support, vision, and commitment toward us and conducting managing the program, making it a huge success. Thank you, sir. I owe a special gratitude to our beloved teachers, non-teaching staffs, and students of Lisie Medical and Education Institutions and the IT department who made this meeting possible, and all the good hearts who worked behind the screen. Last but not least, once again, on behalf of Lisie College of Allied Health Sciences, I thank each and everyone who participated in this meeting and for making the program a huge success. Thank you. Thank you, Lord.
Thank you, Ebin. An anthem.
Mrs. And it made miss before proceeding that Lisie anthem.
Yes.
I would like to comment one more thing. Usha madam, it was a nice presentation. Actually, പെട്ടെന്ന് വോട്ട് ഓഫ് താങ്ക്സ് വിളിക്കും ഞാൻ കരുതിയില്ല, അതുകൊണ്ടാണ് അന്നേരം പറയാതിരുന്നത്. മാഡം പറഞ്ഞ ഒന്ന് രണ്ട് പോയിന്റ്സ് എനിക്ക് തോന്നുന്നു നേഴ്സസിന് മാത്രമല്ല അലൈഡ് ഹെൽത്ത് സയൻസ് എസ്പെഷ്യലി ലാബ് ടെക്നോളജിയിൽ വർക്ക് ചെയ്യാൻ ഇനി ഭാവിയിൽ വർക്ക് ചെയ്യാൻ വേണ്ടി പോകുന്ന കുട്ടികൾക്ക് പ്രൊഫഷണൽസിന് ഇമ്പോർട്ടൻസ് ആണ്. ഒരുപക്ഷെ നേരത്തെ ഡോക്ടർ അരുൺ സൂചിപ്പിച്ചതുപോലെ ഒരു പേഷ്യന്റ് ഏത് ബ്ലഡ് ടെസ്റ്റ് ആയിക്കോട്ടെ, എസ്പെഷ്യലി ഡയബറ്റിക്കുമായി ബന്ധപ്പെട്ട ബ്ലഡ് ടെസ്റ്റ് വരുമ്പോൾ അവർക്ക് ഇപ്പൊ ഏകദേശം ജനറൽ നാട്ടുകാർക്കൊക്കെ അറിയാം എത്രയാണ് നോർമൽ വാല്യൂ, എന്താണ് അവസ്ഥ എന്നൊക്കെ കാര്യങ്ങളൊക്കെ അറിയാം. എന്നിരുന്നാലും നിങ്ങളോട് ചോദിക്കും എന്താണ് ഞാൻ എൻ്റെ ലെവല് നോർമൽ ലെവലാണോ, അല്ല എന്താണ് പ്രശ്നങ്ങളുണ്ടോ കാര്യങ്ങളുണ്ടോ എന്നൊക്കെ ഉള്ളത്. അപ്പോൾ പലരും പല അഭിപ്രായങ്ങൾ, നേരത്തെ മാഡം സൂചിപ്പിച്ചതുപോലെ ചില ആൾക്കാർ പറയും ഓക്കെ ഡോക്ടേഴ്സിനോട് ചോദിച്ചു എന്നുള്ളത് പറയും. ചിലവർ ആ വാല്യൂ നോക്കിയിട്ട് ആ വാല്യൂവിനെ മാത്രം ബേസ് ചെയ്തിട്ട് അങ്ങോട്ടേക്ക് സജഷൻസ് കൊടുക്കും. അതായത് 4 വർഷമോ അല്ലെങ്കിൽ 2 വർഷമോ നമ്മൾ പഠിച്ചിട്ടുള്ള ആ നോളേജ് ഒന്നും അവിടെ ഇംപ്ലിമെന്റ് ചെയ്യാൻ നോക്കുന്നില്ല. അപ്പോൾ ഈ ടെസ്റ്റ് റിസൾട്ട് ആയാലും ഒരു പക്ഷേ തെറ്റുകൾ വരാൻ അല്ലെങ്കിൽ വേരിയേഷൻ വരാൻ, ഇനി നന്നായി ചെയ്താലും പേഷ്യന്റിന്റെ പ്രിപ്പറേഷന്റെ ഭാഗമായിട്ടുള്ള വേരിയേഷൻസ് ഉണ്ടാകാനുള്ള സാധ്യതകളൊക്കെ ഉണ്ട്. അതേപോലെ നോർമൽ വാല്യൂസിൽ അങ്ങനെ ഇഷ്ടംപോലെ കാര്യങ്ങളൊക്കെ ഉണ്ട്. അതൊക്കെ നമ്മൾ പഠിച്ചിരുന്നാൽ പോലും ഒന്നും പഠിക്കാത്ത ഒരാളെ പോലെയാണ് പലപ്പോഴും റിപ്ലൈ കൊടുക്കുക. ഒന്നിക്ക് നമ്മൾ പറയും ഓക്കെ എന്ന ആൾക്കാരോട് ചോദിച്ചോളൂ എന്ന് പറയും, അല്ലെങ്കിൽ നമ്മളത് നോക്കിയിട്ട് തെറ്റായിട്ടുള്ള ഇന്റർപ്രിട്ടേഷൻ കൊടുക്കും. ആ രീതിയിലേക്ക് മാറരുത്. ഇപ്പൊ പലരും ജെറിയച്ചൻ മുതൽ ഉഷ മാഡം ഉൾപ്പെടെ അരുൺ ഡോക്ടർ ഉൾപ്പെടെ സൂചിപ്പിച്ചിട്ടുള്ളത് നമ്മളെല്ലാവരും ഈ എഡ്യൂക്കേഷന്റെയും അവയർനെസിന്റെയും ഭാഗമാണ്. സാധാരണ ജനങ്ങളെക്കാൾ റെസ്പോൺസിബിലിറ്റിയും നോളേജും ഈ കാര്യത്തിൽ നമുക്കുണ്ട്. അപ്പോൾ കൃത്യമായിട്ടുള്ള എല്ലാ കാര്യങ്ങളെ പറ്റിയും നമുക്ക് പറയാൻ പറ്റില്ല. ഇങ്ങനെ കുറെ കാര്യങ്ങളുണ്ടല്ലോ നമ്മുടെ ലൈഫ് സ്റ്റൈലുമായി ബന്ധപ്പെട്ട പല കാര്യങ്ങളും, ഷുഗർ ടെസ്റ്റ് ആവട്ടെ, കൊളസ്ട്രോൾ ആകട്ടെ, ബാക്കിയുള്ള കാര്യങ്ങളൊക്കെ, അതിനെ പറ്റിയുള്ള കൃത്യമായിട്ടുള്ള ഇന്റർപ്രിട്ടേഷൻ നോളേജ് ഒക്കെ നമുക്ക് ഉണ്ടാവണം. അത് വരുന്ന പേഷ്യൻസിന് പറഞ്ഞു കൊടുക്കാൻ നമ്മൾക്ക് കഴിവുണ്ടാവുകയും വേണം. അതിന് നമ്മൾ ബാധ്യസ്ഥരുമാണ്. പക്ഷെ പറഞ്ഞു കൊടുക്കുമ്പോൾ അറിയാത്ത കാര്യങ്ങൾ പറയരുത്, റോങ് ഇൻഫർമേഷൻ പറയരുത് എന്നുള്ളത് മാത്രമാണ്. അത് മാഡം സൂചിപ്പിച്ചിട്ടുണ്ടായിരുന്നു നേഴ്സിന്റെ കാര്യത്തിൽ, അത് എല്ലാവർക്കും ബാധകമാണ് എന്നുള്ളതാണ്. ആൻഡ് തീമുമായി ഏകദേശം എന്നല്ല മുഴുവൻ പോയിന്റ്സ് മാഡം ചെയ്തിട്ടുണ്ട്. അപ്പോൾ മാഡം ഇറ്റ് വാസ് എ നൈസ് പ്രസന്റേഷൻ ആൻഡ് വൺസ് അഗൈൻ thank you.
Thank you, Dr. Shabeer.
Yeah, and Mary madam, you can proceed.
Thank you, Shabeer sir, and thank you once again, madam, for your valuable presence. An anthem is to rouse the spirits and uplift the souls. It enthuses us with pride for being a part of an institution, which makes us hold our heads high. It is now our time to show the overwhelming feeling of loyalty and faith which sums up in our anthem. Let's proudly be part of it.
ശതകോടി നമസ്കാരം നിൻ പാദയുഗളത്തിൽ ലിസി നാമധാരണിയ രോഗകാരിണി. ശതകോടി നമസ്കാരം നിൻ പാദയുഗളത്തിൽ ലിസി നാമധാരണിയ രോഗകാരിണി. ആതുര സേവന സോനവനത്തിൽ വാടാമലരായി മരുവും വന്ദേ. താവകസത്പാരമ്പര്യത്തിൻ താവിനു മഹിമകൾ അറിവൂ ഞങ്ങൾ. താവക ആശംസകൾ നേർന്നിടട്ടെ. ജയ ജയ കൃപദേ വത്സല ചിത്തേ, ജയ ജയ കൃപദേ വത്സല ചിത്തേ, ജയ ജയ മഹിത ഗുണോജ്വല ചരിതേ, ജയ ജയ മഹിത ഗുണോജ്വല ചരിതേ, ജയ ജയ മഹിത ഗുണോജ്വല ചരിതേ. സത്യമാ
So the program is officially ended. Thank you all.
Okay, thank you, sir.
Thank you, sir.
Thank you.